Dr. Chang is with us. She's really the director of the Southern California Reproductive Center. I failed to mention that. I just wanted to give you that shout out. Talking about freezing eggs. We were talking about the upside, and it's really exciting to be able to do this, but the downside is cost.
Yes, it is a significant investment in your future. It costs about $8,000 to $13,000 per single treatment cycle. Depends a little bit on meds in the clinic, but that's the general ballpark.
Wait, what do we? I'm sorry. When you say single treatment, is that per egg? Is that per?
Good question. So, in a single treatment, most young women can generate anything from 8 to 15 or 20 or more eggs. So it depends on the woman's egg reserve, but a single treatment usually makes more than one egg.
Okay. So, do all 20 of those eggs get frozen, or do they just select them? Okay.
Absolutely. We want to save them.
Is there a way to test them to make sure that they'll be viable and that the chromosomes are, I guess, for lack of a better understanding, in check?
Right.
Yes,
absolutely, there is. But if you test the egg, you'll destroy it. So after the egg is thawed and exposed to sperm and becomes an embryo, then we can test the eggs very safely and effectively.
So I have a question. When I was doing my research, I came across a program where you could essentially donate half of your eggs to a woman, who's looking to go through IVF, and then you'd keep half yourself. What do you think of that?
I think that if you don't have the resources or the funds to freeze eggs on your own, that gives you an option because it lets you be altruistic and you get to keep some eggs you otherwise wouldn't have. But there are medical and surgical risks. We know that the medications give you a slightly higher risk of heart attack, blood clot, stroke, like the pill. And the surgery can carry a risk of bleeding. So you would be really carefully screened, your doctor would test you, and then it would be safe to proceed.
There are a psychological aspect of it too, because then you'll have babies out there that you may or may not know are out there.
Absolutely. Wow. That's something else to think about.
How are the eggs changed through this whole process? How is a frozen egg different from an egg that obviously has not yet been frozen?
That's a great question. There are some subtle differences between a frozen and non-frozen egg, but the good news is for pregnancy rates in women 40 and under, they're exactly the same. And in terms of the most important outcomes moms want to know about, birth defects, chromosome abnormalities like Down syndrome, they're comparable with the general population.
How do you begin searching a place to go and know the clinic is right for you? Or
well, I'd recommend finding a clinic where they have board-certified physicians and embryology members. You also want to look for a technology called vitrification. That's a rapid cooling process that freezes the egg in a split second. That reduces damage. It's associated with higher pregnancy rates. So if you're asking, ask for that technology.
What, Shirley?
What kind of security are there with your eggs? Do you know that they're there, that no one took them, especially if you're well known?
That's exactly.
Is it my egg when it goes? You know what I mean?
Well, it's different for every laboratory, but we have things under a double lock process. Not even doctors can go in, only embryologists. Every time we take eggs or embryos, anything, there's a triple check process where we have to identify the patient identifies herself back, and so forth. So it's very secure.
How long, when we say freezing your eggs, how shelf life, I guess? Yeah, how long can they
stay
survive
frozen?
And be
a
healthy?
long time. We know that theoretically they can be frozen indefinitely because when you're down at minus 196 degrees, there's no activity going on. But we don't have a lot of research, so we're not having women do studies where they come back in time when they thaw. But we know there was a recent report of a baby born 14 years after an egg freeze and thaw, and that baby's healthy.
I have a personal story about that. A friend of mine who, when it first started years ago, froze her eggs. She had babies, she had 2 children years ago, froze the eggs. At 51 years old, she said to her husband, let's see if those are still around. They did the first round, didn't happen. Second round didn't happen. The third round, she said, it's our last one, let's try it. She carried her own baby at 51 years old with her own eggs.
So what you're saying is I don't need to rush.
No!
32? All right.
Well, if you would like more information, you can go to Dr. Chang's website, the Southern California Reproductive Center's website.